So most common mistakes for physio to do a C2 central or unilateral PA. Number one, they don't observe, and as soon as they are asked to do this technique, they start going gung ho, like that. Okay, you can see that huge movement, very visible movement. It's as we said, the neck is very delicate. You don't want this large movement. You flare up patients, you create undue pain, you flare up their symptoms easily. Number two, they don't feel. The neck, you can very easily palpate and pick up which level has problem. If your hand is very light, if you have a light hand, you can pick up really well. Okay, if you go gung ho straight away, when you push so hard, all the sensory receptors in your thumb, they fire up, and you can't differentiate. You can't pick up the subtle change in the tissue texture. Okay, so make sure you approach. You really take your time to feel with your thumb by going sideways like that. The next common mistake is, I know the university teach you PA by picking up, by doing a pickup on the skin. Okay, I found this is unnecessary. Okay, by picking up the skin, if you just pick up slightly like that, it's okay. It creates a bit more excursion. Okay, but most physio will pick up the skin so tight, so much that the patient actually feels choking in the front, like that, and that's very uncomfortable. Very uncomfortable. It feels choked. Okay, so that's another mistake. Next one is again, it's the grading. So make sure it's grade 4, small amplitude. Okay, most physio do their grade 4 like that. So a large amplitude from the beginning of range to the end of range. That's not grade 4. Okay, grade 4 is very small, tiny amplitude at the end of range. Those are the common mistakes for C2 PA and unilateral PA.